even though our buildings might be closed right now, the center is closed to the public, that the team at the center is here for you. We have our phones manned and we are at your service. So this is a really difficult time. Many of us have been in our houses now since March, but want everyone to remember that you're not alone, and always feel free to reach out. So again, I'm here to talk about substance use, and what that really means is the misuse of alcohol or non-prescribed prescription drugs. And we're seeing that the misuse of alcohol in particular among older adults is a significant issue, and it's on the rise. Especially with this pandemic, we're seeing that alcohol sales are on the rise. So what I'm gonna do is just go through some resources to support you and your family if you have any questions or any needs during this time. So first and foremost, I mentioned the Center at the Heights. We have a wonderful team of social workers that you can call anytime. We will get back to you. We're meant to be your navigators, your supporters. Whatever issue you may be having, whether it's acute, whether it's non-acute, we want to hear from you. We want to hear from you on your good days, and we want to hear from you on your not so good days. So call us, and all these resources that I'm going to discuss with you, we have in our back pocket, so we'll guide you through it. We won't ever just give you a phone number and send you on your way. We're here for you. An important resource to think about is your primary care physician. That might be someone who you've had a very long relationship with. They know you well. So if you're struggling with substance use issues, we always want you to reach out to your primary care physician. Especially with older adults, you may have more chronic health conditions. You may be on medications. So we want to make sure that your doctor is in the loop and you're getting fully assessed for whatever might be going on with you. If you're in crisis, always feel free to call 911. Our social work team, the public health department, the fire department, the police department, emergency services, we all work together. We're all part of a team. Everyone is trained in mental health concerns, trained in substance use, so feel free to reach out if you're in crisis. If you are hesitant to call 911, or you feel like you don't want to go to the hospital, but you need to talk to someone immediately, we work with a wonderful agency called Riverside Community Services. They have an emergency hotline available 24 hours a day, 7 days a week. They can come to your home. They can talk to you on the phone. You can meet them in their office. They'll work with you to find resources right away if you need them. They have trained clinicians, and they're a great resource. If it's maybe not an emergency, but you're looking for support, Needham works with another group called Interface. They are trained graduate students, also available by phone. You tell them what you're looking for, whether it be hooked up with a therapist, maybe for some counseling, a psychiatrist if you feel like you might need some medications. You can call them. Again, tell them what you're looking for, tell them your insurance, where you live, and they'll work to connect you with a clinician, and that's a free service. As well as Riverside is also a free service. Multiple departments within the town of Needham have been working to put together what's called Get Connected. It lists all different resources, and that's a great start towards getting some help as well. There's a state hotline called the Massachusetts Substance Use Helpline. It's a 7-day-a-week hotline that you can call, state-funded, and again, you tell them what you're looking for. They'll look for resources across the state, whether it be for a hospital bed for substance use or mental health, whether it be outpatient care, say you want to see someone in the community, a support group, you name it. They'll do the research for you and get you that information so that you can get the help that you need. Another thing to think about is elder protective services. And I know that this can seem like a very intimidating resource, but a resource is exactly what it is. There's a hotline you can call through the state if you're an older adult and you feel like your health or your safety is at risk. You can call them and get connected with a caseworker, and their goal is really to help make sure that you're safe and to provide you with the resources that you need. And that's a free service. You can call for yourself. You can call for a family member who's an older adult. It's just another way to get help if you're looking for it.